The task force, which will be led by all of you, thank you so much for being here, will produce a summary of progress made to date, along with the workforce-based interventions and recommendations for action. The task force together will also produce an advocacy agenda for our leaders here to take forth to state and federal policymakers to support the workforce interventions and other necessary public policy changes that will result in a better access to care. I'm going to hand things off to my boss, Mayor of Cleveland, Justin Bibb, and I want to thank you to County Executive Ronayne for being here today. I know this is an issue near and dear to both of your hearts.
Yeah. Thank you, Director Rose, for your leadership in bringing this body together to tackle this important issue in our city and across the county. In January of this past year, we convened a group of mental health practitioners to really think about what are the challenges and opportunities in this sector. That led to us inviting the U.S. Surgeon General, Dr. Vivek Murthy, to Cleveland. We had two roundtable conversations. The first was around how do we continue to support the mental health workforce development ecosystem throughout the city of Cleveland. And the second most profound part of our conversation was a fireside chat with youth in Cleveland. And I'll never forget the conversation I had with a junior at John Hay High School. She said when COVID-19 happened, things were going well. She was engaged on Zoom, got a routine, but then as classes resumed, she felt as if the world was moving, but she wasn't. The world was moving, but she wasn't. I think a lot of our young people are feeling that same sense of loneliness and isolation right now, not just in Cleveland, but across the country. I think it's why you see an uptick in juvenile crime in our community. I think it's why you see an increase in loneliness and suicides in our community. And we can't solve and address this issue if we don't have the people supports to really help our young people thrive. And so we're really excited about this task force. Over the next 180 days, this task force will do a couple of things. Number one, make sure we have a shared agenda to hold ourselves accountable to invest in the workforce component around supporting youth mental health workers. The other 6 specific areas will focus on equitable pay for behavioral health providers, loan forgiveness, professional capacity building, interstate licensure simplification, diversity and equity, and integrated behavioral health care. If we don't solve this problem for our community, it's going to undermine all the big things we want to do in terms of truly creating prosperity and opportunities in our neighborhoods. And so I'm excited for the work ahead, excited for the candid conversation today, and I'm looking forward to working with all of you and our county executive to make some material progress on this important issue for our community. Chris?
Thank you, Mayor, and thank you all for being here today. Look around this table and around this room and recognize that this is a room full of people who will get things done in our county, and thank you for your commitment to our community, and Mayor, for your leadership. I want to just say, as a county executive, I've got a number of my department directors with me today in our cabinet, and many of our team. We're 4,200 strong at the county, and we're very dedicated to the issue of children and youth services, first and foremost, wellness of our young people. I brought forth an idea in the campaign that we should be in this administration all about health, the health of our people in this community. If we're not healthy, we don't get very far. And mental health is a health issue that we need to tackle head on. It became very clear to me quickly as a incoming county executive at the beginning of this year that it was not for lack of will, but we are right now for lack of workers, and we're short, and we need to address that. And so I'm so grateful that Director Rose and Assistant Director Chalker have put together an agenda that effectively looks at our mental health needs as a workforce need too, and putting the needs of the health of our people and our young people together with the needs in our workforce system to address it. It's right where we need to be at that nexus. So thank you, partners. I want to say I try every week to get out to one of our nonprofit partners on the front line and meet somebody who's doing something for our people. And I'm humbled by the nonprofit work on the front line in this community. And of course, working with the for-profit sector to help bridge what I think could be the best public-private nonprofit partnership in this country. because we together have built the foundation for it, and now we just have to deploy it. On the specifics, I'm looking forward to talking more with you about the Sprint Task Force and where we're going to take this. But I think Mayor Bibb hit the nail on the head. We just need to invest in our youth. It is they are 100% of our future, and we need to address the issues of mental health head on. Again, back on the trail for a year and a half, you meet a lot of people, you hear a lot about needs, but I have a memorable moment of meeting with one of our healthcare institutions, Metro Health, and lead administrators there saying to me that our number one crisis in public health is isolation. And that isolation that was beginning before the pandemic but was exacerbated by the pandemic, and the need then to remote commute and the beginnings of remote work. But doing more and more remotely has left just us with that remoteness, and the idea that we together can bridge the gaps in people's lives and create opportunities to socialize, to be together, to work together. But again, to get deep into the issues of what our younger people need means we need workers to do it. So I'm really looking forward to working with the City of Cleveland and all of our nonprofit partners around this table to invest in more mental health workers, particularly as they tend to the needs of our youth. Thank you for leading on this, on the workforce side, Michelle and Laura and Mayor, we're with you. So one more time to the nonprofits, let's do this together and tackle it head on. Thank you.
I truly wish we had time for every single person around this table to speak, because you all have so many valuable things to add, but I'm going to ask just a few people to say a few words before we open it up for Q&A. I'm going to start, I know you're all doctors, but I'm going to call you by your first names because we're going to be friends soon. If I could ask Scott from the Adams Board to kick us off here, just about work that you've been doing a lot of thinking and work on this already. If you can just briefly summarize that as we get started.
Yes, thank you very much. So I want to thank Mayor Bibb and Executive Ronayne, because these efforts really complement, right, what the Adams Board has been doing. And behavioral health work shortage has been a major focus of the Adams Board. We began with a workforce task force back in 21 and 22, and a report came out of that, and we talked with our providers and things of all the things that needed to be done, and we came up with some short and long-term strategies that we have. We also took our efforts and we linked them to our diversity, equity, and inclusion program that we also have. So we've been working with a consultants on that. So what they did is they actually went out and asked our providers to see their job descriptions to make sure, that they're diverse and things like that, and going through the process of how you hire somebody as well. So that's been a lot of things that we have done. One of the major things that we also did within the state budget is we advocated for a Medicaid rate increase for behavioral health care. So that amounted to a 10% increase in the Medicaid rate. So we're hoping that that will also help, right? One other thing that we also did, which we're very proud of, is we teamed up with the Education Service Center, and we created 21 short video vignettes and also 10-minute video compilations that's at elementary, middle school, and high school levels to feature a variety of careers in behavioral health. And that's something that we're looking down the pipe, right? We're going to bring more people into the behavioral health workforce. So it's not a quick fix, but it's going to be a fix eventually. We want people to know that that is a valuable career. We've done a lot of other things. One thing that we're also doing is we're a community preceptor for local universities, and Claire heads that for us. We've also been looking at digital and AI technology. We've been bringing that to our providers to see if that could also help with the workflow, right? Because the workflow would also help with attracting people to the area. One other thing too, which is a major thing, is equitable pay for behavioral health providers, right? We all know that behavioral health care has not kept up with the same rates as physical health care. So in one of our recent budgets, we tried to address the children's residential crisis, and we provided, I think it was $1.5 million to 3 of our providers so they could retain and attract workers. So we still have a lot of effort to do in that. But as we're looking through our budget for this year, that we're seeing how are different ways that we could fund programs, right, to make sure that the providers are getting the pay that they really deserve. Because, right, it is a difficult job, and there's a lot of stress in that, but pay will also help as well. They're coming out of school with $100,000 or more worth of debt, and if they can get paid a living wage, that would really be something that we could help. So those are just some of the things that I wanted to mention, as well as the governor and OMAS has put a lot of money behind this as well. Ohio's Great Mind Fellowship Program, which is $8.5 million, and that's to help people with their tuition. Workforce Welcome Back campaign to tell people who may have left and went to other areas or have retired to come back. You know, we need you there. And then also Behavioral Health Workforce Technical Assistance Center. So he put $1.5 million into that to look into these issues as well. So we're really excited about the task force. You know, we are a major partner with you guys, and we definitely want to make sure that, you know, we'll be able to tackle this. But once again, you know, there's things we could do right away, and there's things that down the road.
Yep.
Yep.
Very good.
Thank you.
Thank you.
Next, I'm going to ask Sabiba Grimes from Positive Education Program to say a bit about the work you've been doing in this space.
Thank you. First, Mayor Bibb, County Executive Renee, thank you for the vision to bring this group of people together. Thank you for your leadership. We have been really focused on how we create a workforce who has the relational capacity to support the needs of the young people we serve. These increased needs mean increased stress and a further decline in the professional quality of life for people who work in the youth mental health space. And it is not easy to ameliorate that, to address the crises and the violence even that these professionals experience in their work day. So by building their relational capacity, we are focused on building their intellectual capabilities, so the knowledge that they have, trauma-informed practice, and other strategies that help to meet the needs of the young people we serve while those needs are intense. Thinking about that ecologically so that there are multi-generational interventions that are available to our professionals. And we also want to help them stay as regulated as possible in the course of their workday and have the relational wealth that they need. So a team of professionals who can be collaborated with and to team the needs that they see. What we're experiencing is a high level of turnover, and so while we've been benefited by a veteran staff over the years, the course of our 50-year existence, that work together and you have those different levels of experience, we have work to do to ensure that new professionals have what they need to collaborate, to partner, and to address these needs, even if they don't have a degree or credential licensure. And we have demonstrated through our course of our existence that that is entirely possible when you have natural child care workers who show up in the space. The other thing I want to mention that's a priority for us is ensuring that our young people have access to professionals who have shared lived experience, shared identity. And individuals who come from marginalized communities, Black, Indigenous, other people of color, have these historical barriers to them entering into this profession. Ensuring they have a living wage is essential to that, but also have pathways to grow as professionals and have access to those credentials that they desire. So those are our priorities in this current time, and I'm really excited they align so beautifully with the priorities of this work.
What's the biggest driver of turnover?
Professional quality of life. Being in an environment where you're working with young people who are highly stressed. And the reality is that the adults, from parents and caregivers to community members to educators to those mental health professionals, have been deeply stressed by the pandemic, but also the racialized violence that was witnessed during the course of the pandemic, that plus economic stressors and so on. And so when you have adults who are not as regulated, when they are encountering young people who are highly dysregulated, it is much harder to reduce that sense of distress. And there are other career options that come with, in some instances, higher salaries and better benefits. And so you see people exiting not just mental health, but also education, which I think is important to just name here, because schools are on the front lines of meeting these needs with young people, and their workforce is also deeply stressed. So given our mission, we're at that intersection and witnessing both levels of distress in adults be quite high, and are not equipped ourselves with the resources that we need to bring down that daily arousal in the work environment.
That's great insight.
Thank you. And then I will welcome our newest entrants to the task force, Dr. Warren Morgan, the new CEO of CMSD. For those of you who have not got a chance to meet with him yet, just to say a few words about your priorities and vision for this work.
Yeah, thank you so much. I'm just grateful to be in the space to collaborate with all of you amazing leaders for this very important task. So thank you for the joint vision that you both provided. I'm a month into the role, and it's been overwhelming, but in such a great way. So great to see all the resources that are here in our wonderful city. and in our county. That gives me a lot of hope for what we can do collectively together for our scholars. I just recently announced that I'm doing this listening tour, and I've already started getting out into the community and just hearing what's top of mind from our parents and also from our scholars, because some of them have gone back to school. And you hear about mental health coming up. You hear about safety and wellness in schools. So it's a top priority. But to that point of just thinking about all the resources that are here, we have to really think about what are those proof points that we actually realize the work that we're doing is actually making an impact. And so I'm really excited to hear about all the efforts and learn about all the efforts. And I want to make sure that we're not being reactive to every situation, and our kids come with so many different challenges, and there are so many different things that happen to them, but we have to be proactive so that we're putting systems in place that are not only protecting the mental health of our adults. And yeah, I was definitely listening as you were mentioning all the work that you're doing, Abiba, because I could say amen to all of those things that you were mentioning, because our adults are on the front line, but we also have to put the systems in place for our scholars. As the mayor mentioned, the student he was talking about and how much has changed since the pandemic. Schooling is changing. The way we have to do school has to be different. We're faced at with chronic absenteeism rates being at one of the highest rates. Our on track to graduation rate slipped during the pandemic, and so did our proficiency rates. And on top of that, I know last year was a very challenging year for culture and climate and safety issues that happened not only within the school, but to and from the school. And so when we think about all the resources that we're doing here for mental health, I want to think about the programs that are going to be supporting our scholars as well as the adults that support our scholars. But on the other end of it, I would be really excited about us coming together for a collective vision of what are those proof points that we actually know we're truly making a difference. So just glad to be here to work with each of you, and yeah, really excited to get to work.
Thank you. We now have time to take questions from the press who are present. Marie in the corner can help us facilitate this question, but we're happy to take questions.
Hi, Emma with Channel 3.
Hi.
I feel like I should introduce myself. I'm really curious how you're hoping that this will trickle into education and our school systems. Obviously, getting access to healthcare outside of the school is very important, but when it comes to behavioral health, things like that in school, what are we hoping long-term, short-term this will do?
I can tee it up and hand the ball to Dr. Morgan. First and foremost, the question is spot on, Emma. When I took office last year, I began to have quarterly conversations with students across the district. And I remember asking this one question amongst the students. Raise your hand if you would want to have a therapist. Would you take up on that offer? Every kid raised their hand.
Mm-hmm.
You know what the caveat was? For them and their parents too, or someone in the house.
Okay.
But what's positive about that response from them was, we are now having an honest conversation about mental health and getting treatment, particularly in Black and brown neighborhoods in our city, which is great progress. And so we use a significant portion of American Rescue Plan dollars to expand the integrated health initiative at CMSD and all of the Say Yes schools, and that's something we want to build on across the district. We want to make sure that every child in CMSD inside the school has access to the behavioral health they need to meet their daily needs. Dr. Morgan?
Yeah, I think it's a lot of what has already been said here in terms of just the importance of the resources to wrap around the student, but also the adult. I think back when I was a high school principal in Chicago, as budgets continue to be less, every year my budget was less and less, I was faced with decisions on, do I have a social worker or a mental health provider? Do I have security officers in my building? And our principals here and CMSD are faced with the same thing. There are teacher shortages. There are lack of adults in the building. And so when you think about that, just to do the regular job of schooling and on top of all of the challenges our scholars are faced with, it's an enormous task. And we won't be able to reach those proof points that I was mentioning. And so it's great to know that there's a task force looking at this, and there are other resources we can tap into and learn about, because the resources sometimes within the school and the school system are drowning out. We also are coming on the end of our ESSER. ESSER helped a lot of districts across the country think about recovery from the pandemic, and this is the last school year for it. And so we're faced in this school year making some really tough decisions. And so I'm just really grateful to be around this table to find out how we can partner and make sure there's continuity of services, but also the expanded excellence of service.
And I'll just add from the county perspective, there was a lot of discussion last year, maybe debate about county's involvement in the Say Yes program. And the Say Yes program dollars that came from county were specifically for family support specialists. And I doubled down on that and wholly endorsed it, and we got it over the line. But it was maybe needed to be better articulated. That what we were trying to do, like Dr. Morgan said, is put adult specialists in the schools to be the support to the teachers, the administrators, and the students first and foremost. I'll just add that we all know, education and just creating youth opportunity doesn't end at the end of the school day, the school hours. We need to focus on out of school time initiatives and summer initiatives. And again, this partnership around this table, I know we can, and Mayor, we support you and Dr. Morgan in trying to make sure that all of our kids, in whatever school they're in this county, but specifically supporting our city kids. That's what we were trying to do last year and what we continue to do. So we're looking forward to further partnering with you on that.
Good afternoon, I'm Caitlin McCarthy with Channel 19. What kind of role does addressing mental health needs play into reducing youth violence and crime?
Well, first, I would say you're more likely to potentially get caught up in violent crime if your social and emotional supports aren't addressed. Everything from depression to the violence of systemic poverty that we have in our city, to the fact that from an environmental justice standpoint, if you live in a neighborhood with low air quality and not a robust tree canopy, you have lower health outcomes, you live in a heat island, you're more likely to potentially get involved in violent crime. And so we believe that addressing the issues around youth mental health will go a long way to reducing violent crime in our city. This is a long-term strategy, and as we all recognize, solving violent crime requires a multi-pronged approach. That's why earlier today, Chief Sonny Pryor-Jones, myself, Dr. Warren Morgan, and others across this table, for the first time in our city's history, we convened key stakeholders to have a cross-sector training to make sure we have a complete strategy around safety coordination, having a trauma-informed response to all the needs of our young people. And so we believe it's a part of the solution. It's not the solution, but it's a part of a multi-pronged, all-of-government approach to really address the needs of our young people.
Any other questions? Other questions?
It also makes a big, I'm gonna share with you, it's big. You don't even know what families are going through in their house. And to have this task force doing what they're doing, it opens the portals for them to say, this is what I'm hurting about. Hurt people. Mm-hmm. And it's going to take some time, but once we know we got help, we'll quit hurting each other. See, that's important. So I thank you all.
Right.
I thank you all. This is big.
Well, and the work's just beginning. I mean, we know that reducing isolation reduces mental health challenges, reduces addiction challenges, reduces crime. But looking at it the other way, let's find every which way to engage our kids, and especially in this online world that does tend to isolate. We need to get kids outdoors. We need to get kids engaged in every which way possible. I'd compliment you for what you do at night with basketball programs. It's just every which way. This is a team effort, and I want to just come back to the point of the workforce. What we're here today about investing in specialists. Bridging that gap by paying our workers, training our workers, making sure that the profession is known out there and how important it is in our community. We all need to support it. So, you know, there's two sides to this. There's all of us together in the engagement of youth, and there's also us investing in the workforce side of the specialists that we're talking about. And the county looks forward to, again, partnering with all of you on that.
Go ahead, Emma. I just want to make sure that we're pointing people to the correct resources if they see this story tonight and they may need them. Should we be directing to the Adams Board, probably the crisis hotline? Is that the best?
Yeah.
All right, and then obviously if any of you guys have any follow-up stories or anything, please feel free to reach out to us. This is a topic that's very important, so, we don't need to just meet at these big round tables. So, thank you.
And Michelle and Laura can't say that because they work with the workforce development team, but the mayor and I have really committed to creating a unified front when it comes to workforce development and not being in silos, and working together on careers that matter and the impact of the lives of people. So once again, thank you for identifying mental health services as a workforce development need. We see it right now for the gap that we have in terms of workers, and to reinvest in workforce training for the workers and us paying our workers to get on the job and help our community. It's within us, but you identified rightly a sector that we need to invest in.
Hi, I'm Cindy Hill from the Land, and I wanted to find out if families have places that they can provide feedback within all your organizations, if we could, publish that for them to know, if you have a voice and you really need to be heard, this is what you do.
Sure, so that can happen through any of the partners here at the table. And I do think it's important that as we embark on this 6-month sprint task force, that we are hearing from young people in particular and their parents about the work that we're producing.
Question for Executive Renee. What's the mechanism you're envisioning for increasing pay? Is that something accomplished through legislation, or what's
And the county side for county paid specialists, it will be. But I think, again, this discussion amongst all of us is how do we bridge gaps? I mean, we, coming out of the pandemic, had a huge shortage in, I'll just say social workers broadly, social workers. But we just had to, internally in our case, address the fact that we had a gap of somewhere upwards of 300 social workers by paying people more. It's just what we had to do at the county government, and it was right, it was just. And I think we just need to face ourselves on, if this is a priority, we have to invest, exactly.
Hi, my name is Yin Pu, and I do the Chinese newspaper. I bring two gentlemen here, one from Canada, one from the local, which is a new one. They did it for last year for September in the Akron, but this year, September 12, they key theater do the Christmas Candela, which is a teaching for the God, and they got tickets for the free, which is wonderful for the family and the kids together. I just want everybody to know. If you have any detailed question, you can ask it to Jennifer.
Thank you.
Thank you.
Thank you.
Welcome.
Other questions? Good. Okay, thank y'all. Thank you very much.
Thanks, everybody.
Thank you, sir.
Thank you, guys. That was a great roundtable. Can we stay a while? Get some more stuff done. Yeah. Hey, Kevin, nice to see you. Chris.
I took your family picture at your
at the event.
Yeah.
Thank you.
The state of the county.
Nice to see you.
So I tried to get in touch to schedule a meeting with you.